Well, this is Dr. Judy Shaw with Shaw Medical Travel Consultants, and we're bringing to you today another interview with Dr. Aneita High. Dr. Aneita High is one of the consultants with Shaw Medical Travel Consultants, and today we're going to talk about mental health and volunteerism. So before we get started, I'm going to read a little bit about Dr. High. She is a board-certified psychiatrist in child and adult psychiatry. She completed her BS in psychology from Yale University, then received her medical degree from Medical University of South Carolina. She has over 20 years worth of experience in correctional psychiatry, adult and child residential care, day treatments, inpatient psychiatry, and school-based and community-based clinics with at-risk youths and underserved populations. Dr. High has studied a large body of evidence that highlights the long-term ineffectiveness of volunteerism, as well as the potential detriment it poses to the communities it is meant to serve. So on that note, Dr. High, how are you doing?
I'm doing well. Thank you for having me.
Great. You know, I'd also mention that Dr. High spends part of her time in Kenya, serving alongside her husband in Teule, Kenya, a registered NGO that serves orphaned and vulnerable children. Correct me again, what was the pronunciation there?
It's Teule.
Teule.
Okay.
Okay.
It means chosen in Swahili.
Wonderful. Okay, so let's get started, Dr. High.
Mm-hmm.
So we're going to talk about mental health and volunteerism, initially as it relates to those who are on the receiving end of the volunteerism. Mm-hmm. And later in our part two, we're actually going to talk about the effects on those who are providing the volunteer service. Yes. Okay, so let's start off with just a gestalt, you know, what is, in your opinion, or how bad of an impact have you seen in your experience, is the impact of volunteerism on those receiving the services?
So, to put it into context, volunteerism in and of itself is not necessarily bad, but when it's done without the input and the understanding of what the real problems are, it doesn't serve the purpose of the community that it's supposed to. And that's where the detriment comes. So if you're working with a population and you come in with your own ideas of what the problems are and how to fix it without actually getting a good understanding from the people who are being impacted by whatever problem you're looking at is, and what their solutions that could be sustainable are, then your impact is going to be short term and in some cases may actually be detrimental to that community. And so I just want to preface it with that. So when we think about the mental health, there's several different types of things that can happen. They're positive impacts and they're negative. But when I think of the negative, you want to think of what happens to a community where they feel like they don't have any power or they don't have any agency to make positive changes for themselves. And so what happens is you can create a sense of dependency, which is exactly not what you want, because what you want is to help the community identify their own solutions and come alongside them so that they are creating solutions that they can sustain whether or not the volunteers come back. And that's the goal. So,
so sustainability.
Sustainability, but also appropriate context.
Yes.
If you have solutions that aren't going to be relevant to their culture, and to be nice or to be accommodating to whoever's coming to help them, you know, what's the expression? Don't bite the hand that feeds you.
Right. Yeah.
You go along, a community might go along with solutions that is presented to them because, well, this is the help that they want to offer, as opposed to what is how can we help you do what you want to do?
Got it. Got it. And so, okay, so you put us in context. So, in your experience, all things being equal.
Yeah.
Okay? All things being equal, how much of a problem have you identified or have you seen in your experience?
So it depends. So a lot of research in volunteerism that works towards serving children and taking care of needy children. What happens is they can develop unhealthy attachments, so that they're able to attach to many people.
Yes.
But that's not healthy.
Yes.
You need to grow up to attach to people who have proven themselves over time. So it makes these children, when they grow up, more vulnerable to victimization, to not want to connect with their community as much, because why am I going to connect with my community when I have these people that are coming and they bring me things and whatever. So there's a level of entitlement that comes about. There's a level of undermining healthy bonds with their community. That is concerning. And then perpetuating, especially if you're working with orphan children, you're perpetuating these unhealthy attachments, like I said, where they easily attach to people that haven't earned the ability to bond with.
And I can imagine that this is something that oftentimes people, lay people, they have no clue. They don't think about these things. And in your experience rather, organizations that support or fund volunteers, is this something that is practiced? Is this something that is considered and somehow mitigated?
So this is definitely something that's considered. It's on the radar. If you look at things on UNICEF or different organizations that receive funding, there are criteria of the type of volunteerism you do. So this really looks at providing volunteering to provide direct care to a child. So people who are volunteering as caregivers. Which is very different from someone who's coming to build a wall. Or someone who's doing a sports camp. Or, you know what I mean? So they're not putting themselves, knowing that they're temporary, in a place of being a permanent caregiver role. And so there's a lot of, for example, in our, is actually a regulation in Kenya that you don't have volunteers serve as caregivers. And so there are, depending on the country, national guidelines on what kind of volunteer work people can come in and do in your institution. So it is known internationally, especially in the nonprofit sector. And so many countries have put things in place to help mitigate that, but then it's the follow through and who's regulating that.
So that was going to be my next question. So onus then put on the host country, or is this the volunteer organization who is ensuring that these mitigating measures are put in place?
I think both. I think the onus should be on everybody.
Yes, of course.
Where, if you are a US or European-based organization that's sending volunteers, they should be doing their due diligence to make sure that the organizations they're partnering with are operating under international standards, as well as, those who are on the ground, and they are giving volunteers the opportunities, making sure that, okay, we have things set in a situation that is going to meet the emotional needs of the people we're serving in the best way possible.
And okay, so that's from an organization standpoint, and that's from the country standpoint, or a state, city, or what have you. But so is instruction actually given, and what is the instruction that's given to the actual volunteers? How are they coached or taught, or what?
And most organizations have a volunteer manual, as well as for our organization, there's actually a child protection policy that volunteers have to read and agree to abide by to volunteer if they're going to be volunteering within the home. And so most organizations that are involved with children require that. They require a background check because there's also the risk of victimization, you know, and doing an orientation on the ground.
Right. Okay.
So what does that look like? You know, here's the packet that you received, but then what does that look like in real time on the ground?
So the long-term effects of this on a child receiving services, and we're talking about children, but I'm sure there's also some negativity that can occur with adults as well. Okay?
Yeah.
So, and of course, these children grow up into adults at some point. So
yes.
So what kind of long-term effects do you see as a child growing up, or well, let's start with that. As a child growing up, what kind of long-term effects do you see from this kind of scenario?
Yeah.
I mean,
so,
you did touch on the issue of attachment, but outside of that, what kind of mental health issues?
So when you think of the impact of having poor attachment, the long-term impact in having unhealthy relationships, it can lead to anxiety. It can lead to depression. It can lead to further victimization, where, you know, if I don't know how to have healthy bounds, then I am more likely to put myself in these negative emotional and relational situations because someone hasn't been vetted. So, you know, so risk for further victimization, which could lead to, like I said, a lot of other issues like anxiety, trauma-based concerns. There's not like a, like I was a victim of volunteerism disorder, but it puts you at risk for these other things. And I think probably the greatest mental health impact is lack of connection to their community. Because
the problem, once these volunteers leave and go back home, you got to go back, you have to deal with people, and you have to become a young adult, a teenager, a young adult, and you have to know how to deal with folks. Yeah,
well, not only these people go home, but also I grow up and I'm no longer a part of the children's home that I'm in, you know. And so this is a problem that we see even here in the United States with kids who grow up in the system, the foster care system, where they've had multiple caregivers over time, and they are never really connected or rooted into a community. So they flounder a lot in their early adolescence, in their late adolescence, early adulthood, to find community, to learn how to operate in community. It's easy for me to maintain a relationship with someone who's going to be here for 2 weeks, 3 months, and may not have a lot of negative interactions because it's all positive, as opposed to learning how to traverse the ups and downs of natural relationships. And so if you think about what's the long-term effect of having lifelong broken relationships, it's huge, especially with and so that's something even in our children's home that we are working towards, where as we're serving these children, how do we keep them connected to their community, you know, connected to their whether it's their tribal community, the local community, giving them opportunities to interact with children in homes, like friends and so forth, so that when they leave, they're not like, oh, now I'm abandoned again.
You touched on the issue of entitlement. What does that mean exactly? And how does that demonstrate itself?
Yes. So that's a very great question. So what happens is you have this unrealistic expectation that when somebody comes, they're going to meet my needs. And there becomes a reliance on external support as opposed to looking at how I can empower myself. and creating a level of dependency where the expectation is when somebody comes in, they need to give me something. And that is also very dangerous. We have a rule where kids can't ask for gifts from volunteers, and volunteers can't give gifts directly to children because it creates this unhealthy expectation of, I'm always looking to see what I can get from that other person.
Right. Got it.
Which long term is not a healthy way to interact with the world. And it never gets into the place where they feel like I have something to give. So another way that we try to counteract that.
Yeah. Okay.
Another way we try to counteract that in our home is we set up service trips every school break, and the kids get to give ideas of how they want to give back in the community, whether we reach out and give food items or clothes items, or, you know, go to the hospital and do a cleanup, so that they're not always the ones who are receiving, but they also recognize
that's important. Never thought about that.
So important. Yeah.
Now, clearly you put that into play in your organization, but and obviously you're a psychiatrist, so you have, you know, knowledge, but I would imagine that there are the whole host of other volunteer organizations out there that may not have a psychiatrist at the helm. You know, I would imagine folks coming, they give stuff to kids that they ask for, you know, I like your shoes, can I have your shoes? I like your earrings, yeah, I like your
all the time. Shirt. Oh, I love those sunglasses.
Yeah, your sunglasses, your shirt, whatever. I mean, would it be the exception then that there's that kind of a rule that you have, or is this some kind of known expectation that, okay, when you come, you don't give, and as you said, I mean, I'm just trying to establish a norm. Is there a norm?
And that's pretty much been a standard. And I think one of the benefits of the organizations that I've worked with is they've always had a contact in country. So it wasn't all just foreign input. Like, people on the ground from the community were there.
Right.
And I think a lot of it was learning along the way, but over time recognizing, okay, this isn't helpful. And I think by having people that are in the country that understand the culture, that understands the needs of the community, and be like, yeah, we don't need to do that, or y'all don't need to do that. That's not really helpful. And people who are coming in having the understanding and humility to be like, okay, well, you know this area better than we do, so we're going to honor what you're saying that's going to align with your culture. Yeah. So I do believe that there is a level of understanding in a lot of the nonprofit world about that.
Okay. So good. Okay. And so let's shift a little bit. So between the issue of children and adults. So and well, we've talked about children, and what I said was children grow into adults, and you've addressed that. But for those people who are already adults, when they come into the volunteer system, you know, there's some organizations that they go to country and they you know, offer clinical care, medical care, or they go to help build houses, or they go and do that. So it's not really that children orphanage type of exposure, but it's adults. So what's the how is that related from an adult standpoint to mental health?
Yeah. So what I would say is, and just to backtrack a little bit with the children, I think one of the benefits of working with children is that they are very impressionable about the context in which things are presented. And so we know that people come in and out of our lives. That's a part of life. And so if we teach the children that people are coming in for a season,
right,
and we can celebrate the purpose of that season, and we don't have to be sad in the sense that I'm being rejected again when that season ends.
Yes.
as opposed to this is a part of life and I get to enjoy and celebrate what good came out of that season and continue to grow in other seasons. You know, so I think that's really important when you're working with children, especially depending on their developmental age. And then for adults, I think also the context in which the volunteerism is occurring. Are we coming alongside these people as opposed to creating a savior mentality? Here we are coming in to save the day, as opposed to thinking you created these problems so you can't figure out how to fix them. Or a lot of them are situations that they had no control over, but they were just circumstances that have come upon them. So I think in some cases when, you know, for example, if you're thinking of a community where there are a lot of single moms who don't have a lot of resources and someone comes in along and they empower them with ability to gain an income for themselves, then you have this positive impact where I'm not being thought of as less than. They see my value and they're investing in me. And so I think there's a difference when people feel like they're being invested in because people see and recognize the value of who they are and what they can do for themselves if they have the proper tools and support. And yeah, and I think even with our children, like we tell them we're investing in them because we believe in their future. We believe in the talents and the gifts that they have, and so their past is just a part of their story. It's not the end of their story.
Got it. Love that.
Yeah.
I love that approach. And you could say the same thing with the adults. I mean,
exactly.
Right? I mean, they have a past too, and they're going through some issues, difficulties, or what have you. And so, again, from an investment to their future, that's a great statement.
Yeah. And their community.
Yes.
What I am often like, not necessarily shocked by it, but one of the things is like how often like the government and the leadership of the country have neglected certain populations. And a lot of these people feel forgotten and useless which is obviously not true. So to have a group of people who have taken of their time, their resources to spend time and help build up their community with them, and I say with them purposely, speaks lots of value, and it helps them to dream even more for their own community and their own future.
Okay, so that's key, and that's important, and that sort of helps empowering, and that sort of helps for them to, again, back to the issue of sustainability, helps them with that sustainability. Because at the end of the day, from a volunteer standpoint, I would hope that that's what all volunteer organizations are hoping for, that you would help the community to be self-sustaining.
Exactly.
Okay, well, you know what? This has been great. So let's close out this video as it relates to the children, and as it relates to those who are on the receiving end of volunteering. In our next video, we're actually going to talk about the impact on those offering the volunteer services. Okay, so let's just close this out by you helping us to understand. Just give us some key pointers. Top key pointers to summarize, what we've discussed and what you feel to be most important as it relates to take-home message.
I think one of the most important things, is when you're volunteering, especially when there are children involved, making sure that as a volunteer, it's not about you. I've gone on trips where volunteers who've been there a week or 2 weeks, they're bawling like they've left their grandmother. And I'm really like, who is that serving?
Right.
Yeah, you will be sad, but hold that in, because you create a memory.
Yes.
And when you think of kids who've been abandoned or taken from their homes, whatever, those can be triggering
Yeah, so key, so key.
events as opposed to reparative.
Yeah, yep. I see how
Can we create good goodbyes as
that.
opposed to reinforcing bad goodbyes?
Yeah.
And I think that's probably one of the top things that I would mention, because the kids are going to be sad. And I've seen it, you know, they've made new friends, they've had lots of fun. And now it's kind of like when you have people come and visit you and your kids are so excited because they have their cousins there or whoever. And then when everybody leaves, it's like, oh,
Yeah.
But imagine that on a multiplied scale.
Yeah.
With children who've already had traumatic separations.
Yes. Yeah.
Do your part in helping create good goodbyes, and that would be my take home.
Okay.
Do your part in not valuing your volunteerism as much as putting value on investment in them. And that might look different depending on what kind of context you're volunteering in.
Yeah.
Speaking to the hope that you are sowing into.
Yeah. Okay.
And it doesn't end with you.
Yeah.
It continues.
Excellent. Okay, great. This is excellent. I want to thank you, Dr. High, for taking the time to chit chat with us a little bit about this. This has been very helpful, and I think it'll be very helpful for others who are considering volunteering, and maybe even some organizations that are trying to establish a volunteer opportunity to help certain communities. Because at the end of the day, you know, we want it to be a win-win. Okay, and we want to make sure that those that we're offering services to see value that is long-term and endurable and works toward their sustainability. So again, thank you. And again, this is Dr. Shaw with Shaw Medical Travel Consultants. This is Dr. Aneita High. And go ahead and please give us a like on this video. And also please subscribe to our channel. Because we have many more videos like this that are going to be coming. So thanks a lot and good day.